Hello, this is Dr. David Green, Education Director for Premier Pain Specialists in Chicago. Today's topic is what you need to know about fibromyalgia. Fibromyalgia is a connective, soft tissue disease involving chronic, spontaneous, and widespread musculoskeletal pain, as well as recurrent fatigue and sleep disturbance, according to McGill's medical guide. The condition presents multiple tender spots on the body that are primarily found on the back, the neck, the chest, hips, arms, and legs. Fibromyalgia used to be called chronic pain syndrome, psychogenic rheumatism, and fibrositis. All those refer to the same thing. 3.5% of women in the U.S. and 0.5% of men have fibromyalgia, with the typical age range being between 30 and 50. 3/4 of those who have fibromyalgia actually go undiagnosed. How do you know if you have it? Well, the American College of Rheumatology has put together some guidelines. History of several areas of aches or pains for a minimum of 3 months. Having at least 11 of 18 locations on the body that are significantly tender. You can see those on the cartoon to the right. And if it's close but not quite fibromyalgia, it's called myofascial pain syndrome, which gets the same treatment anyway. Journal of the American Medical Association put together some guidelines quite a bunch of years ago. Generalized and chronic aches and pains or stiffness present for over 3 months in 3 or more anatomic areas. Same tender points as you saw on the previous slide. No other identifiable condition that the symptoms could represent. And then there's these minor criteria, including fatigue, headaches, neck and shoulder pain, sleep disturbances, bowel irritability, and some numbness and swelling. Oftentimes, it's simply a diagnosis of exclusion. Doctor will go down the list. It could be this, could it be this, could it be this. And if it doesn't fit into any of those, it turns out that it's actually fibromyalgia. What are the best treatment options for fibromyalgia? Well, alternative medicine is becoming more and more popular with treatments such as acupuncture, chiropractic adjustments when tolerated, physical therapy, massage, aromatherapy, homeopathic medicines, spa baths, relaxing herbals, music therapy, and yoga as well. When it comes to traditional medications, this includes off-label use of antidepressants, analgesics like NSAIDs, muscle relaxers, acetaminophen, opiate medications, membrane stabilizing drugs such as Lyrica, some of which are FDA approved, sleeping aids, and then there's actually an IV infusion treatment called a Myers cocktail that can help patients tremendously. Lyrica was the first FDA approved drug for specifically treating fibromyalgia back in 2007. In 2008, the second drug called Cymbalta was approved, and then a third actually has been approved called Savella. We don't actually know how any of these works. We just know that in large studies, they do help a lot for fibromyalgia patients. The Myers cocktail, in about 5 years ago, 2009, there was a pilot study done. Most subjects experienced relief as compared to baseline, but there really were no statistically significant differences. And that's not totally unusual in a pilot study, but there's so many case studies and anecdotal reports that it's actually a very popular treatment because there's really no risk involved. There's no cure for fibromyalgia. It's a very challenging condition. The National Fibromyalgia Association shows that patients can decrease symptoms dramatically through multimodality treatment. The top non-operative pain management in the Chicago metro area is with Premier Pain Specialists. There are several clinics throughout the metro area accepting over 50 insurances and providing over 25 treatment options. Excellent success rates with the board-certified award-winning doctors. Visit us online today at ppschicago.com and then call us for more information and scheduling at 847-519-4701. Thank you very much for watching.